illicit trafficking. To speak to us about this, we have Dan Katenda from the Uganda Harm Reduction Network, which is helping fight drug abuse in Uganda. A very good afternoon and welcome to NTV at 1.
Good afternoon to you and good afternoon to the viewers.
Well, looking at the current statistics, how are we doing in terms of misuse of drugs, and do you think the COVID-19 situation has worsened that?
Just to inform you, Uganda is grappling with the drug use problem, and for so many years, this problem has been so much in across the regions of Uganda. But to add on that is that Uganda for so many years has not had the treatment, care and rehabilitation centers. Currently, before in that first wave of COVID, Harm Reduction Network with the support from CDC, IDI and Utabika, we established the medical assisted therapy treatment clinic at Utabika Hospital, where all people who are grappling with drug use can go and access treatment. This service is for free for all who can be able to travel to Utabika. But because of COVID-19, things have changed where people cannot travel to from where they are to Utabika Hospital.
All right. Now, once again, would like to dive into some of the issues that you think are hindering the fight against misuse of drugs in Uganda. Do you think it's as a result of it not being prioritized?
Yeah, basically true. Domestically here, the government has not invested in harm reduction programs. Which harm reduction programs we think we think are vital for people who are grappling with the use of drugs. The recent study that was conducted by Harm Reduction International clearly indicated that almost 99% is international funding. And here the government has not invested in the establishment of treatment, care and rehabilitation centers for people who are grappling with use of drugs. What we appreciate from the government is that currently we have the universal guidelines for prevention, for HIV prevention, care and treatment of people who use drugs, which we think if the government continues to commit, to have that commitment to harm reduction, then people, we can have harm reduction implemented in all the regions of Uganda and the facilities. But currently, as I talk, it is just limited to Kampala and Wakiso.
All right. Now, Mr. Dan Katenda, just briefly speak to us about today's theme. The theme today is Share Facts on Drugs Save Lives. Of what importance is this, and why should we as a country be commemorating and celebrating this day?
Yeah, thank you so much. When you look at the constituents of people who use drugs, currently the HIV prevalence stands at 17% compared to the general population of 6.2%. That's according to WFIA. So the percentage of the prevalence of people who use drugs is almost doubles. That means the problem is more, the problem of HIV is more into the people who use drugs. Why we are so much concerned about the day and the theme to share facts is that we have laws and policies that are so much affecting the service delivery for people who use drugs. One of them is the Narcotics and Psychotropic Substance Act, which has provisions and which impedes most of people who use drugs from access to HIV services. You will also find that even us who are supporting people who use drugs are so much limited because there are provisions in that act that even those ones aiding, supporting or giving support to people who use drugs as if we are aiding use of drugs. Yeah. So what we are calling for the government is the number one policy and law reforms, that at least some of the bad provisions can be removed from the Narcotics and Psychotropic Substance Act, that at least we can have implementation of harm reduction interventions across the country, that at least essential services such as medical assisted therapy, the so-called MAT, and NSP can be embraced in all the facilities of Uganda.
All right. Thank you so much, Mr. Dan Katenda, for joining us today on NTV at 1. He is from Uganda Harm Reduction Network. Today we're commemorating the International Day Against Drug Abuse and Illicit Trafficking.